see you're my new patient, right? Okay, hi. I'm Dr. Jen. Yes, Jen Doodle. Thank you for being here. Okay, let's just finishing this up. Okay, and your name is? Right. Okay, and it looks like we have all your information already here. So, let's go ahead and get started. Oops, hair got in there. Okay, so I was told you're in here for frequent headaches, correct? Okay, I'm so sorry to hear that. I know from experience how truly terrible it is in your own life to have frequent headaches. It's very painful. So hopefully this examination today will help. I'm thankful you made it in today. Okay, like I said, I'm Dr. Jen. So we're going to do a few tests right here. We are going to do a sensory test. That means physical feeling. So if you can feel. And we're going to do a light test. That means we'll use little laser lights and you'll tell me if you can see them or not. The series of tests. And a color test. That's the only other thing we'll have to do today, okay? And that means we'll do different tricks and we'll see if you can tell the color or not. Let's see if we can find out what's going on with these headaches. Okay. Well, let's go ahead and start out with the light test. So this is just my regular light here. This is very normal. So let's go ahead and start by examining your eyes, okay? Okay. Now, I'm just going to be very gentle. Is it okay if I go ahead and touch your eyelid and just move it up? Is that okay? I'm going to try to be very gentle. That's okay? Alright. I'm just going to poke it up. There we go. I'm going to look right under there. Okay. Alright. It looks pretty good. Do you have glasses? You have contacts in one eye, okay? Which eye is that? Your other eye, okay. Yeah, this eye looks amazing. Okay. Okay. Good. Alright, now I'm gonna go ahead and lift that other eye up, okay? I see a little bit of inflammation. Okay, nothing too severe, so those look good. Glad to see that. I'm gonna go ahead and have you just follow this light for me though, both eyes. Yeah, go ahead and just look at me. Good. Good. Alright. That looks awesome. We're going to go ahead and do a little bit more of a direct light here though, taking this part of the stethoscope off. And let's look a little more direct. Just saying, look at me. Look right at my nose if that helps to focus. Good. Yeah, don't follow the light, just look at my nose. Okay. Well, that looks awesome. I don't see anything that's concerning to me yet. That's great news. That can be a very scary thing when those things are not working properly. So I think you should be a little relieved for that. Now, we're going to go ahead and try some red light though. red lights are very important for your eyes to see. It's, many people have color blindness, but it also can be the cause of a tumor or various other medical diseases. So we just want to make sure nothing else is going on, okay? Now this is going to be quite intense. I want you to go ahead and still keep looking at you can look at my eyes or my nose, just somewhere, okay? Don't look directly in this light. Okay, good. Look right here. Good, good. Do you have any Christmas plans? That sounds fun. Wow. Good, 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 good. Well, it will definitely be a funner Christmas if we can make sure you're not having any headaches, right? Yes. Okay. The good news is I'm not seeing any reasons for concern yet. You can look directly at the light this time. I'm not seeing any reasons for concern. I know, I'm sorry, it is very harsh. So, that means that the reasons for your headache are probably not going to be super intense. Can't promise that, but you should be very relieved to hear that. This is a bright blue one. So that is great news. The light part of this testing is very, very scary and important, so I think you should be very relieved to hear that some of that is taken care of. Okay, next we're going to go ahead and do the sensory part of this test, and it is usually my favorite. I find it very relaxing, so I hope you do too, and can really help us figure out, if there's actually anything going on physically in your body as well. So let's go ahead and try this. I'm going to be running this little Q-tip, fresh Q-tip here, all over, and you're going to tell me if you can feel it or not, okay? Okay, let's go ahead and start on right here on your cheek, okay? Do you feel that? Yeah, okay, good. You can usually tell when you're not able to feel things, right? Sometimes it's alarming. People can't tell for a while and then all of a sudden they've lost feeling. I know it sounds crazy, but it's good to check these things. Okay, I'm going to go right over your eyebrow. How's that? You feel that? Good. Other eyebrow. And your other cheek. Good, good. Okay, and now I'm going to go ahead and do your chin here. And I know these may seem random, but our brain is a very strange organ. The way we find things can be very mysterious. Did you feel that on your chin? Yes, okay, good. Now, I know this sounds a little silly. I'm going to be going right around those nostrils, okay? So I'm sorry if it's a little uncomfortable. Did you feel that? Yeah, okay. Alright, well that's great. This is usually the lightest way of, most people can feel this, so that's good. I'm glad to see that on you. And next one. The next test is a silicone. These little rubber things here. And we're going to see if you can feel those on your face, okay? Okay. I'm gonna go just do the same thing. Let's start with your cheek. Do you feel that? Good. Okay. I'm gonna go all across your other cheek here. Do you feel that? Okay, good, good. And right on top on your head. You did feel that. Okay, good. Oh, I almost forgot the cheek. I almost forgot your chin now, didn't I? Okay, good. I almost put it away. Were there any areas you did not feel? No. Okay, good. Good deal. Okay, the last sensory test we're gonna do, just going to be using a little brush here and brushing around your face, okay? So, this one is very relaxing. You can close your eyes if you'd like to, because these brushes can be quite abrasive right in the eyes, so I don't want you to get poked. Okay. Yes, that could make your headaches worse, right? Alright, I'm just gonna start at your forehead here. And let me know if you think you're feeling anywhere that you can't feel it. I'm on your right side right now. Right side of the forehead. You can feel that. I'm on the left side of your forehead. And right on your nose. I know, it makes me sneeze. It's ticklish. Okay, and right underneath your eye. Oh, you're not feeling that? Okay. Very interesting. Nothing to worry about. Okay, so you're not feeling that. Okay. That is helpful. Okay, how about the other side, right underneath your eye? You're not feeling that either. Okay. That's a helpful thing to hear here. So, thank you for letting me know. And we'll keep doing some investigation. How about your chin here? No, please don't worry. You know, this is really very normal. You're actually doing much better than most patients, so I don't want you to get worried, okay? Okay. Healthy as a horse. Chin? You can feel your chin. Okay. I'm just gonna go all the way around, make sure you feel that. Just underneath your eyes, huh? Okay. Alright, well, the most common cause of loss under here during the sensitivity test is usually a sinus, very puffiness that can hit on nerves and really cause a lot of inflammation. So that's what I'm gonna guess is going on so far. Do you have any allergies, or are you used to seasonal puffiness, anything like that? No? Okay. Well, it's not uncommon for it to just present randomly, and it can be very painful. I also have allergies and can present right under here in pain. It can be very painful, so that's what I'm gonna guess so far, but let's go ahead and carry on with our exam, okay? The last part is the colors. Aren't these pretty. I'm gonna have you go. We're gonna close one eye and then the other. And this is just going to test once again to make sure there's nothing going on in the brain, and that we can really identify if this is something going on, you know, in the cranials or the nerves, okay? Besides just the sinuses. Yeah, okay. Alright, I want you to close one eye. Either one's fine. Okay, good. Now, I'm gonna put up color and I want you to go ahead and name it. Let's mix it up. Okay. Can you go ahead and look with that one eye and tell me what color this is? Yes, it's pink. Good. Now let's pick a different color family. Tell me what color this is. It's blurry, huh? Okay. That's interesting. And this is the eye that needs contacts, huh? Okay, yeah. No, that's okay. These are very small. Let's go ahead and do that other eye. Can you tell me what color this is? Gray, good. Okay, I'm pretty much determined. You know, we don't need to go on with this, so yes, let's go ahead and put that up. Okay, and so after examining you, I don't have any concerns about anything going on in your brain that looks suspicious, so that's really great. And I know right here worried you that you didn't pass one of the test, but I really do have the suspicion that this is going to be a just a sinus problem, and those can be very painful, so I'm not trying to diminish anything, but I'm going to recommend an ear, nose, and throat doctor for you, a specialist. I know a fantastic one, and they're very low cost, they're great to their customers, and I think that would be a great place for you to go next. But in the meantime, to our people who struggle with this, I recommend this. It's a Chinese medicine for sinus pain. So let me show you what we have here. Now these are very ice cold. They stay ice cold because they're made out of metal. And really, I'll just demonstrate on myself here. You find right here, this is your sinus passage. It's very cold. Now I want you to massage like this. And that's really going to help those sinuses drain. So when you are, you know, really puffy, I'm going to go ahead and give these to you today. Try it out. See how it's going. I really recommend going to the ear, nose, and throat doctor. I think they'll be a great help for you. So I'm going to go ahead and try this on you, okay? I'm going to lift up right here, okay? Is that alright? Yeah, alright. And I'm going to massage. Yeah, it's cold, isn't it? Yeah. Yeah, it feels very relaxing. Another thing you can try is a nasal rinse. And that is very uncomfortable for some people, I know, but it's really amazing for your sinuses. Really clears them out. So yeah, I want you to go ahead and take these, try that. Another area you can try is right here where you are not feeling anything. You can just go in a little triangle right here. There's usually lots of build up for people who have sinus issues right there. Can just help get things moving, okay? Let me try that as well, right on you, okay? Okay. So go ahead, you can take these, alright? Alright, well, I think your exam is through today. You did excellent. I don't want you to be scared about anything. I have determined that you really have nothing to be worried about. So that's amazing. You did great. I am going to go ahead and write down the recommendation of where to go for your sinus, ears, nose, and throat doctor, okay? In the meantime, I'm going to go ahead and give you a prescription medication that will really help those sinuses, and I'll give you one more for pain in case that's not seeming to help in the meantime until you get to the ears, nose, and throat doctor. Especially with Christmas coming up, I want you to be as comfortable as possible. Yes. Thank you so much for coming in today. It was my pleasure. I'm always here to talk, to listen to any concerns you have. And was there any other questions or concerns you had? Write this prescription. No? Okay. And I can send this into your pharmacy if you like. Okay. Here you are, and you have a wonderful day. Thank you so much for coming in. And make sure to call if you do have any more questions, okay? You matter here, and we want to make sure you are taken care of. Alright, thank you. Hey, if you're watching, thank you so much. And I'm just starting out here on YouTube, so please do subscribe. Thank you, and have a wonderful rest of your day.